When the limitations of the scalpel were fully exposed, humanity began to prey to two invisible weapons. One was radium, discovered by the Koreans. It could emit deadly radiation, which could necrotize and shrink cancer tissue like magic. For a time, radium became a sacred relic sent by God to end cancer. It was made into face creams that made skin glow, radium water for strengthening the body, and even radium-containing chocolate and toothpaste. However, the myth collapsed quickly and tragically. The first to fall were the workers who had close contact with radium. Young female workers, in order to paint radium-containing fluorescent paint on watch dials, were taught to lick the tips of their brushes with their lips. They swallowed radium into their bodies day after day. After work, their bodies would glow with a charming faint light, earning them the nickname Radium Girls. A few years later, their teeth fell out for no reason. Their jawbones shattered like hollowed-out rotten wood, and they suffered severe bone pain all over their bodies before dying soon after. At the same time, devoted consumers of radium also paid with their lives. American millionaire Eben Byers drank approximately 1,400 bottles of radium water over 2 years. In 1930, his jawbone began to necrotize and fall off, and uncontrollable tumors grew all over his body. A dark joke in the newspapers read, "The radium water worked perfectly until his jaw fell off." In the end, he also became a footnote to radium. The birth of the other weapon originated from hell. During World War II, a US military ship carrying the chemical weapon mustard gas was hit by German forces. When military doctors treated the poisoned soldiers, they discovered that this toxic gas dealt a devastating blow to rapidly dividing white blood cells. If the gas could kill normal cells, could it also kill the even more wildly dividing cancer cells? After the war, this idea was brought into the laboratory. Scientists used nitrogen mustard, a derivative of mustard gas. For the first time on a patient with advanced lymphoma, the patient's massive tumor shrank rapidly within a few days. Modern chemotherapy thus emerged from humanity's ugliest invention, breaking through the soil. Since then, the three classic treatments, surgery, radiation therapy, and chemotherapy, achieved great success in the mid to late 20th century, but they were like carpet bombing. While destroying cancer cells, they also turned the patient's body into a scorched wasteland. The real turning point came after the molecular biology revolution. Scientists began to delve into the interior of cells to decipher the genetic code that drives cancer. They discovered that the uncontrolled growth of many cancers originates from mutations in one or two key genes. In